Good morning to one and all present here.
On behalf of Mother Divine Public School, I, Sumedha Bakshi,
And I, Akanksha,
welcome you all to an educative and informative session on cancer awareness, followed by the screening camp. We believe that awareness is the first step towards prevention, for the which screening is considered an important preventive measure in controlling any disease.
cancer is a global disease and is spreading rapidly. Cervical and breast cancer are one of the common cancers among females in India and around the globe. Cancer awareness is the key to early detection and better health-seeking behavior.
In pursuit of the same, we feel honored to have with us the experts from Rajiv Gandhi Cancer Institute who will provide valuable insights and share information about the importance of regular health checkups. So, let's welcome the team of doctors from esteemed Healthcare Institute who are highly proficient and dedicated professionals. They aim to simplify the complicated areas of healthcare and well-being. We welcome you wholeheartedly, sir.
I heartily welcome Mr. A.K. Bakshi, Director of Mother Divine Public School, whose experience and commitment has always made a remarkable difference in the field of education.
Sir, I request you to honor our eminent resource persons for today's session with a token of appreciation.
So, we all welcome.
Now I request Bakshi sir to share his valuable insights.
So, good morning, guests and friends. So today is the day when we are to listen about that which I think nobody wishes to listen. There are certain myths. Dr. Harmeet Goel, Dr. Priyanka, and Mr. Gagandeep. I'm sorry, I'm an old man. I start forgetting the things. So I need many reminders before I say what I want to say. So thank you very much for sparing your time and being with us and guiding these people. And we need to get clarified on certain issues which have taken place in the form of myths also. And people have got fear psychosis. That is always there. Like, and the people who are not having that much information, knowledge or education, we can understand that they are having certain apprehensions. But the people who are educated, who are literate enough, they have got dual responsibility. One is to look after themselves and one to look after those people who are not having that much awareness. But there are certain things which have become a form of stigma also. In the morning when I was leaving my place for school, I just asked my wife that today we are having some session like this, a camp like this, why don't you come with me and the professionals will be there. She said, नहीं, कोई और बहन पड़ गया तो problem बाकी की जिंदगी रोते हुए बीतेगी. Why shouldn't we think in that direction? That if, God forbid, something is there, at least we can get a chance to get cured. And I think medically, if I'm not correct, please correct me. Medically, it is established that if certain detections are done at earlier stages, those are absolutely curable. So, in that way, I think today these doctors will be mentoring the mentors and you can further spread this knowledge, information to so many people. And I think this kind of, I remember once, few years back, one doctor, senior doctor, he was an oncologist. He was, I think, head of the department in Batra Hospital. So he came to me that I am transferred to this place and I want admission for my child. I looked at his card and I thought that he's the one who's helping the society so much. So definitely I should give a chance to that person. So I said, okay, Dr. Sahab, your child will be given admission, don't worry. He said, thank you very much. Bakshi sahab, koi aur kaam ho mere like to batana. And I was not in a position to react because neither I felt like saying definitely Dr. Sahab, I'll come to you, nor I could say that nahi, aapke services nahi chahiye. Because this is the one which gives us some sort of dreading things. So I shared with you these 2-3 points just to tell you that we should remove all these statements from our mind, be positive, and I wish all my friends that after the session today, you will not only be having a good knowledge about this problem which we are having in our society, at the same time, you'll have a double confidence that you are free from it and you are healthy and safe. Dr. Sahab, once again, to your team, my thanks, and our school looks forward to seek this kind of help as and when required. Thank you very much.
Thank you, sir. Now I request our distinguished guests to proceed with an enriching and informative session.
Good morning, everyone. Good morning, everyone. Good morning and welcome, everyone. And thank you so much, sir, for your wonderful words of appreciation. Myself, Dr. Harmeet Goel. I am gynecologist in the Preventive Oncology Department of Rajiv Gandhi Cancer Institute and Research Center, Rohini. About our hospital, it's been 25 years old. And it's an organization basically, and it is a non-profitable organization. And whatever is being earned by the hospital, it is being utilized in the hospital services itself. And our Department of Preventive Oncology is to spread awareness to do the screening. With me is Dr. Priyanka, and she is an ENT specialist and working in the Preventive Oncology Department. I am really appreciating the type of crowd I am administering and addressing the crowd, and it's really a wonderful to be here, and it's a great pleasure. About myself, I've done my MBBS from Lady Hardinge Medical College and post-graduation in Obs and Gynae from VMMC Safdarjung Hospital, which is one of the largest 2,000-bedded hospital in Delhi. About our hospital, the Cancer Institute and Research Center, Rohini, that is Rajiv Gandhi. In the ranking, it is #1 Cancer Institute in Delhi, and in the all over India ranking, it is #2 hospital. First is Tata Memorial, and #2 is the Rajiv Gandhi. We have our branch in Niti Bagh also, but this is the main branch. So today we have got the opportunity to spread awareness about the cancer. Cancer is the leading cause of death worldwide, accounting for 1 crore deaths every year. This is 2020 data, and nearly 1 in 6 deaths is because of cancer. Okay, and you will be surprised to know the data that 1 in 10 people in India are at risk of developing cancer. Okay, there are 100 to 200 cancers that can be there, but out of them mostly are benign and some are the malignant. If I talk about the screening cancers, according to WHO and according to Government of India, there are 3 cancers which are preventable. That is the oral cavity cancer, where tobacco is a very biggest risk factor. Number 2, the most common cancer in female in the world and in India is breast cancer. And among the most common cancer of female genital tract is cancer cervix. And there is a lot many myths even in the educated population, and they come to us when we are doing the screening for them. They say, I also have a cervical problem. Am I going to get cancer? So that cervical is different. Cervix cancer is the mouth of the uterus. That is what is a cervix. So which is the most common cancer of female genital tract in India. In the Western world, it is the endometrial cancer, which is the uterine cancer, that is most common. But the incidence is also rising in our country. But presently, no recommendation for the screening of uterine cancer has been there. It is the high risk or those who are having symptoms, we are doing the screening. But talking about the 3 cancers, before I go on to proceed about the data, I would like to just give in a very, very simplified manner so that everyone can understand. And we are looking forward for the teachers and the schools, because they are the ones who can spread happiness. Okay. One example I would like to share it here. One principal of a school, what you can say in Hindi, chapa mara bachon mein. So they got 60, marker pen like things, and it was not marker pen, it was e-cigarettes. Shocking. Parents को लगता है कि बच्चे marker pen ले रहे हैं, but that is e-cigarettes. Very, very shocking. So the adolescent age group, they are very, very fast developing the habit of taking the tobacco in the form of chewable tobacco, in the form of the e-cigarettes, etc. So you as a teachers are the faces we are looking forward that you can guide them, even guide the parents during the PTM time. Okay, and I will talk about the vaccination. There is just one cancer out of all where it is preventable by just vaccination. That is the HPV vaccine, which you must get for yourself, those who are unmarried among you, boys and girls, and for the children, those who are married and are having children. I will just talk about that. Now, in the beginning, I would like to focus on the risk factors. And people think हमें तो हो नहीं सकता है, genetically किसी को कोई दिक्कत ही नहीं है. But let me tell you that 90% of the cancers are environmental factors, that means the man-made, and only 10% of the cancers are genetically transmitted. Alarming, but this is true. Now, what are the major risk factors to begin with? Because if I go into so much of technical terms, it won't be any use. We are talking here about the prevention. We are not talking here about the treatment. Okay, all of us know that prevention is much more better than the cure. Okay, so what are these 4 major risk factors for cancers? Is tobacco, alcohol, obesity, and sedentary lifestyle. Aren't they preventable? They are preventable. Okay, if you have been able to control on these 4 factors, your risk for developing cancer will be reduced to 40 to 50%. Okay, let me tell you one thing. If there is in the media so much things have been made hyped up, like there is an Airbus carrying 200 passengers and it crashed, the news is spread throughout the day in the media, in the TV channels. Okay, but alarming data, in India daily 200 female are dying of cancer cervix, and that too preventable. That means every 8 minutes there is a female death because of cancer cervix, and that is preventable by vaccination, screening, early detection and treatment. So WHO strategy to eradicate cancer cervix is 90, 70, 90. What is this 90, 70, 90? 90% of the girls in our country must be vaccinated. 70% of the female in the reproductive age group must be screened. And 90% of the females who are having symptoms suspicious of cancer cervix should get early detection and treatment so we can eradicate. Surprising, those countries who are very, very small countries, they have been able to achieve the eradication of cancer cervix by 90, 70, 90 policy. 90% of the vaccination in the girls, 70% of the screening, that is a simple test pap smear or HPV DNA test, and 90% should get early detection and treatment. So that is eradication. Alarming, because there is no point in for me to read the PPTs and all. It won't look very, very much interesting. Whatever has to be informative, that is what I am explaining here. So you will be surprised. 90, 70, 90. Where is the India standing? Less than 2% is vaccination. Less than 1% is screening. So long ago, okay, for eradication. And you'll be surprised that 125 countries in the world have included the immunization against cancer cervix, that is HPV vaccination. 125 countries. India में अभी भी नहीं है, ठीक है? There's a strategy planned by the government that they are going to introduce the Cervarix vaccine, which is against HPV infection, okay, to be included in the school health scheme and all that. But not today, it has happened. It is available at cost, okay. So vaccination is very, very important. So why not start with the vaccination part, okay? In the vaccination, you know, like the vaccine which is available is a quadrivalent vaccine, which is Gardasil. It is against, or it is containing the strains of HPV 6 and 11, which is known to cause genital warts, which is sexually transmitted infection, and HPV 16 and 18. These are known to cause cancer cervix. Okay, so this quadrivalent vaccine, the dosage schedule is 0, 2 and 6 months. 0 means today you have to get one injection in the deltoid, and after 2 months another injection, and at 6 months third injection. Okay, now what is the age group for this vaccination? Is 9 to 26 years of age. It can be started as early as 9 years up to 26 years, that is by WHO recommendation. But FDA says 9 to 45 years of age. But at our hospital, Gardasil vaccine is freely available on cost. Okay, so 3 doses. This is quadrivalent vaccine. Now what are the cancers in the female where HPV virus is a risk factor? That is, you know, like cancer cervix, it is proven. Then vulval and vaginal cancers. So that is genital tract cancers. HPV virus is a risk factor where proven for cancer cervix. 100%. Okay. Number 2. Are we supposed to vaccinate our boys also? Yes. Because this virus is sexually transmitted. So what are the cancers which are being caused, or it is a risk factor? HPV is a risk factor for what all cancers? It is penile cancer in the boys, anorectal cancers, and oropharynx cancers. Although the incidence is less in our country because comparatively to the Western countries, the malpractices of sexual, you know, like satisfaction is, you know, like little bit different in our country. But still, the risk is there. So we must vaccinate the boys as well. Now what is the ideal age group for vaccination? Is 11 to 12 years. So your children who are in this age group, you must get them vaccinated. Okay, although it is available at cost, doesn't matter. Okay, when you are going to a restaurant, 4 or 5 friends, is not the cost you're spending?
Yes.
In a good restaurant I'm talking about. Okay, or you're going in a mall. Is that 3,000 or 4,000 is, you know, like you are just ending up buying only 2 clothes or at times 1 cloth only. So is it that more important or vaccinating? What you are going to do and what you are going to leave for your children, that is what is a vaccination. You can get it done. Fine. There's a Gardasil 9 also available, which is a non-avalent vaccine. There are 9 vaccination. I'll keep on talking about this. Okay. So you can see 50% of the deaths from cancer are due to tobacco use, obesity, alcohol consumption, lack of physical activity, low fruit and vegetable intake. Aren't these preventable? All of them are preventable. You know, like what you're offering to your children. Maybe all of you are teachers. Okay, you are the building blocks for the society. Okay, and you can tell in the parents, in the PTM meetings or the children who can understand, avoid junk food, fast food, and I'm sure 100% sure you are must getting so much of projects being done. Even my children are in school, and you know, like they also get the projects and all that.
Yes.
Okay, so all this is preventable causes. So you are all aware and educated people of the society. So you are all aware of these things. Okay, but one more thing is our children do not want to eat the fruits, fresh fruits and vegetables. So many, you know, like people think, हमने तो 250 रुपए का ये खरीदा और ये दिया. Who is saying you have to buy that? Always buy the seasonal ones, not the preservatives used. Fine. Similarly, our hospital says switch over to the vegetarian diet is beneficial because vitamin A rich plant products contains antioxidants like papaya, like carrot, like tomatoes. Okay? So all of you are aware of these things. So cancer causing infections is HPV, which I have already emphasized. Hepatitis, which is already hepatitis B vaccination is already included in our national immunization schedule. I remember when I was doing my MBBS in Lady Hardinge Medical College, you know, like that time HPV, hepatitis B vaccination was not introduced in national immunization schedule. So our preventive and social department got us vaccinated, and we were running and they were after the injections. Nay, you have to get vaccinated and all that. Okay. So cancer, in a simple terms, I won't be using any technical terms. It is just a fast multiplication of the cells, and they have outgrown their blood supply and nutrition. These bunch of the cells, they are, you know, like very immature cells, and what they do, by the bloodstream, by the lymphatics, by the nerves, they just spread or metastasize to different areas and affect the functioning of the body. If there is a metastasis to the brain or any cancer metastasizing to the GIT or the lungs, it's already advanced cancer. So by the time the patients come, it is already advanced. So that is what is the, you know, like thing. For the name of the prevention, people don't turn up. But we have to, you know, like explain them so that they can get, you know, like themselves take the preventive measures. Like I have already said, the environmental factors are 90%, which I have just emphasized, and only 10% are the genetically predisposed factors. Now, what are the top cancers in the males? Okay, so oral cavity and lip, you can say because tobacco chewing, any form of tobacco is harmful, whether it is chewable, pan, khenni, gutka, supari, everything. Even the flavored hookahs, you must have seen, you must have attended the marriages in the farmhouse and all that. Previously, even I was not aware. Okay, and you know, like the children or the boys, especially 18-20 years of age group, arey isme kuch nahi hota, and they were having that flavored hookah. But it is again habit forming. So any kind of tobacco is the biggest risk factor. You'll be surprised to know 40% of the cancers in the male, tobacco is the biggest risk factor. And 20% cancers in the female, tobacco is an associated risk factor. And you think like female to tobacco kahan leti hai? But leti hai. Okay. Just a simple example. Low class society, they take बीड़ी, ठीक है, तंबाकू, ठीक है, वो जो देसी टाइप ऑफ ड्रिंक क्या बोलते हैं, ठीक है, शराब टाइप्स, ठीक है, and because of frustration in life, हिंदी वाली गाली and fighting frustration. High class society, smoking, vaping, अच्छी वाली drink, wine, and English वाली गालियाँ. Styling. That is what is a style. Okay, that's a style icon. But काम तो दोनों सेम ही कर रहे हैं ना. Middle class. इधर हो जाते हैं तो वो लो क्लास की तरह हो जाते हैं, इधर हो जाते हैं तो हाई क्लास की तरह हो जाते हैं. तो पैसा आता है तो सब चलता है. So you can see the lung cancer, again smoking is the biggest risk factor, stomach cancer, colorectal, esophagus, etc. In the females, the top priority for cancers is the breast cancer, cervix cancer is the next, then ovary, lip, and etc. Fine. I keep on getting the patients in the preventive oncology department. There was one female, she came. I was taking the history of tobacco and all. She said, yeah, when I got pregnant, मुझे अजीब सी फीलिंग आई तो मैंने स्टार्ट कर दिया. अब मुझे बहुत अच्छा लगता है. Another lady comes, गुलमंजन. I was not knowing what is this गुलमंजन. It is just tobacco form. ठीक है. Third female came कि बहुत सारी केरीज हो रही थी, किसी ने बोला तो मैंने उसमें टोबैको डाल दिया, पूरा मुंह खराब हो गया. ठीक है. So that is what females are no less. And even many of the females are giving a company to their husbands, those in the kitties and all that. That is only female crowd. So these are the 4 leading lifestyle risk factors for cancers which I have just mentioned: tobacco, diet and obesity, sedentary lifestyle and alcohol. We can overcome all these factors. Okay. Tobacco I have already mentioned. 80% of the mouth cancers are because of the smokeless tobacco, that is chewable tobacco. So these are some of the images which you can see. Cigarette and all that, you know, that is a plain tobacco. This is flavored hookah, vaping, etc. E-cigarettes. All this is habit forming. And you know, like even if any one of your relative is having these habits and all that, looking at just my conversation with you and you start fighting, no, that is not true. What is we just, even if you can always take them for a medical help and all that, first of all is a turkey therapy. Let them not buy, let them not stock. So this is the way I explain. We are having a tobacco cessation counseling unit also in our hospital. Okay. E-cigarettes, young generation. What is this? This is, you know, like style, party style. Okay. So obesity is one of the major risk factors and we can all overcome over it, and I don't find any of the obese personality here among the crowd. So good thing that one risk factor is already 0. That's good. And most of the time I have seen teachers are always running and running and running. Is class mein period hai, is class mein period hai, bhago. That is what? You're doing exercise. And good that this is what is called as a brisk walking, which is very, very important. Half an hour is very, very important. One more bad habit we have is, we keep on waiting for going to the market. Like, husband आएंगे या बेटा आएगा या कोई आएगा, चलो बाइक पे या स्कूटी पे हमें लेके जाएगा. So it develop one more habit to go to the market, which is a nearby by walk. That's also one of the exercise. Okay. So among the other risk factors like coronary heart disease, diabetes, fatty liver, etc., red is cancer because our talk is on cancer. What is a sedentary lifestyle? Everybody can understand from this. So I searched the net and I found this is very useful, and the images itself explaining everything. Pizza, Pepsi. Okay, so 2 risk factors you've already reduced, and I'm sure tobacco and alcohol is also 0. Okay, that I'm 100% sure about you, sir. Yes. So this is what is a sedentary lifestyle. Watching TV, lying down on couch and all that. Okay, so common preventable are these 3 guidelines by the Government of India. Okay, oral cavity, which we are doing here, we have come here for the mouth examination for the males as well as the females, and taking the history of any tobacco or substance abuse. then the breast cancer by the clinical breast examination to be done by me or with my trained sister. And I will be just emphasizing what does the screening means. And the third is the cervical cancer in the females, that is we are going to take pap smear for the married females. And the unmarried girls can also come for just a breast checkup. We don't do any checkup in them. Okay? And vaccination advice I have already given. So what are the warning signs of cancer? Yesterday I just went to one, our team went to this, for a screening camp and all that. It was politically organized and all that. And media people were also there and they were asking me questions and all that. Please, and as an expert, give some advice and all. Okay, they were asking, but they were not ready to listen like you guys and girls are paying so much of attention and all. They have fixed things in their mind. Madam, symptoms बताइए symptoms. अरे यार, पहले prevention की चीजें तो सुन लीजिए, जो सबसे important है. Symptoms का मतलब तो you are almost at risk of developing any change in the voice. I'm sorry to say, teachers and all, they have been speaking out and all that to control so much 50 students class or 40 students class and all that. So that is different. Singers nodule and vocal nodule, that is said, it is common in the teachers and the singers. So that does not mean you fit into this category. Let me clarify. Okay, any change in the voice, hoarseness of the voice, person not able to speak, it is a risk or warning sign of a laryngeal cancer. Okay. Then any change in the bowel habit, you are getting diarrhea for 2 months, 3 months, constipation, or any change in the breast size, or there is indrawing of the nipple, or there is a P2 orange kind of breast, or there's a lump in the breast which is very hard and it is painless. So almost always just refer to a doctor. Urgent attention should be given. Any discharge from the nipple, especially the blood discharge or false smelling discharge, is a warning sign of the cancer breast. And any disturbance in the menstrual cycle, heavy bleeding, irregular bleeding, post-coital bleeding, all this is a warning signs for the cervical cancer or the uterine cancer. Okay. Obesity, weight loss, cachexia, anorexia, all these are for ovarian cancers. Any change in the mole or any lesion in the mouth, so that is respectively the skin cancer or the oral cavity cancer. Sometimes the sharp tooth can cause some irritation in the cheek and all that, and if not treated, because you have to just go to the dentist and get the grinding done. Okay, so that is also a risk factor. There are white patches in the mouth and it is a tobacco chewer or alcohol and all that. That is a risk factor for the oral cavity cancer. Okay. So these are some of the warning signs. Now this is what is a cervix cancer. Very, very simplified. I've selected the specialized, which can be very, very simplified to sensitize. I'm not saying I'm giving any awareness and all that, but it is just sensitizing the educated society. Okay, that is what. So 200 female death because of cancer cervix daily. So why we keep on talking about the cancer cervix? Because it is unique. I just want the previous slide. For this. Yeah. This is the only cancer where we know the causative agent, that is HPV virus. This is the only cancer where we have a vaccination, that is the Gardasil vaccine. And this is the only cancer which we claim to eradicate, where every 8 minutes there is one female death. Where we have vaccination, we know the causative agent, and we can eradicate. But 90 is a far away thing for our country. But what we can do? We can get ourselves screened, we can vaccinate our children. That's what we can do at least. So cancer cervix is highly preventable because when there is an HPV virus, it enters into the epithelial cells there are viral proteins which is causing malignant changes. Okay, 99% this infection clears out. Okay, only 1% if it persists can cause certain changes which can cause cancer. From pre-cancerous to cancerous, there's a long years, like 10 to 15 years. So if we can detect that, we can, treat, and 100% cancer cervix is preventable. Now, who are the females where we are taking the screening sample? That is a female who is sexually active and 21 years of age till 65 this smear is been done. Okay. Recommendation is every 3 years, but we take it because we don't want to miss out any cases. We are doing it yearly. Okay. What are the risk factors for getting the HPV infection? Risk factor for cancer cervix is multiple sexual partners, human papilloma virus infection 16-18, and early age at coitus. All these are the risk factors. Pap smear screening to be started in the married females or sexually active females at 21 years of age, and we have to go for every 3 years. If we are getting HPV DNA testing done, that we are not doing it here at this screening camps, we can do it in our hospital settings. That is on the payment. So then every 5 years, this is confirmatory test. Some of the slides I have just added. So I'm just skipping through all these slides just to show you the vaccination part, which is very, very take-home message for you. Okay. So age group 9 to 26 years, ideal age group is 11 to 12 years. So who all doctors are vaccinating against HPV? It is, first of all you come across the gynecologist, number 2 is the pediatrician. Okay, because adolescent age group are going till 12 years to the pediatrician. Okay, some pediatrician are taking up to 18 years as well, so you can get your children vaccinated. This is Gardasil vaccine, this is nonavalent vaccine, these are the variants and the dosage schedule is the same. Okay, Cervarix, availability is a problem, so we are not promoting because it is not against genital warts. So we are promoting Gardasil and even, Cervavac, that is the Serum Institute. That vaccine is also available. That is again quadrivalent vaccine, but is again at the cost. Okay, disease burden you can see. These are the terms you can see. India, there are 23% of the new cases and cancer cervix in the world, and India contributes to 25% deaths of cancer cervix in the whole world. That is very, very alarming data, and that too preventable. So these are the cancers which have been caused by HPV virus, which I have already enumerated. So much of medical terms. Those who are from the science side can very well understand this. This is the screening. This I have already told you. What are the features which you must not ignore? Any irregular bleeding, any postcoital bleeding, vaginal discharge, always consult your doctor. Okay. This is HPV infection. If there is a train accident or if it is a aeroplane crashing, it becomes a big news, which I have already emphasized. Daily 200 females dying is not a big news, but health is always neglected in our country. Now, if we want to control or treat or eradicate and all that, this is what is a primary prevention, vaccination and screening. So you can do screening, vaccination, early detection and treatment to eradicate. Okay, so you can save the lives. Now how we can eradicate, I have already emphasized 90, 70, 90. But okay, that is WHO guidelines. What we can do it here, vaccinate, get ourselves vaccinated or our children vaccinated and do the screening part. Now talk about the breast cancer, which is the most common cancer. Let me tell you, we are getting, breast lump in 20-year-old female also. Like one of the school we visited, I don't want to name the school particular. So there was one employee in the school, okay, and she was having a breast lump, and because of the money part, she was not going into any hospital. Okay, so we did the screening for the breast and cervix cancer and oral cavity cancer, and if any person is being detected, okay, the we get them, like further treated up to the 5 lakhs if the person is a BPL card holder. Up to 5 lakhs, the hospital is doing the free services, the treatment done. So, breast cancer, what are the risk factors that cannot be changed? If you are a female, gender, you can't change it. Age, you can't change it. Family or personal history, race, genetic factors, menstrual history, reproductive history. Those females who think, now there are late marriages, people don't want to, like have children, high society and all, they don't want to breastfeed the child because of the figure conscious and all. That is all risk factors that must be avoided. So breastfeeding is beneficial for the lady as well as the children because it contains antibodies, so child is getting benefited from so many infections. Now, all women at risk, what are the factors which we can prevent? Can't you prevent obesity, physical inactivity, physical activity, no breastfeeding? Those who are married and having children must breastfeed their child. Alcohol intake should be reduced or made zero. Hormonal replacement therapy in the form of estrogen for the menopausal symptoms is a risk factor. Birth control pills containing high dose of hormones is a risk factor. Not having children is a risk factor. So symptoms of breast cancer and all, pain in the breast, bloody discharge, which I have already emphasized. So what is to be done for the early detection? Self breast examination to be done by the female above 20 years of age every month after the periods are over. And clinical breast examination to be done by the doctor. Okay, 2 to 3 years, once in 2 to 3 years, so we are doing it here today. And then mammography to be done 40 to 50 years, like every 2 to 3 years and above 50 years. In our hospital, the facility for mammography has been available. Those who are in these age group can get it done. It is at cost, but some months, it has been made at a very, very subsidized rate. That is the breast month and all that you can get an information, and it will be done in just 500. And maybe other places, if there is a free campaigning and all, must get your mammography done, and it is not having so much of radiation exposure. Okay, this one is a mammography, and this is a staging for according to the mammography. That will be too much of technicalities. This I have already explained. Okay, so reduce the risk by avoiding tobacco, alcohol, limited exposure to ultraviolet rays, use the sunscreen if you are going into the sun. This is very, very important for you. Eating a diet rich in fruits and vegetables. Your every meal should contain the fruits. Every meal should contain the fruits. Like maintaining a healthy weight, being physically active, seeking regular medical help, and doing the screening for the cancers and all that. Oral, breast and the cervix cancer. So, fresh fruits and vegetables should be added. Zero alcohol, zero tobacco, and obesity to be reduced, and physical activity should be included in your daily schedule. That is what. So physical activity तो कोई problem ही नहीं है आप लोगों के लिए. Obesity भी problem मुझे नहीं लग रहा है, and I don't think any of the risk factor is here in this crowd. Like tobacco, alcohol, again zero. So you are also reduced your 4 important risk factors which I can say. Okay. So cancer is largely a preventable tragedy. Cancer is curable if detected and treated early. Like screening can save the lives. Avoid this food. So I just specified, like what does it mean? We keep on talking about the junk food and all that. But what is that? So it's clear here. Everyone is clear. What is the junk food? So many times our children, and I am not saying in this crowd, you must be giving 10 rupees or 20 rupees to your children. At times I also give to my daughter. Le yaar, chalo. Just to pamper them. Okay? अरे कोई बात नहीं. Just cheer up your mood. कोई बात नहीं, इसमें थोड़े से marks कम आ गए, चल कोई बात नहीं. Pepsi and all. But this is again wrong. Practices to pamper them with this kind of stuff. Okay? This is what you should include. Okay? Daily make it a point. And how can you include the green leafy vegetables? Like जितना हम fiber include करते हैं अपनी diet में, उतना ही flush out होता है चीजें, and that is very, very helpful. So कौन कह रहा है साग खिलाओ, बच्चे नहीं खाते, पालक पनीर दीजिए ना, पालक तो जाहिर है. So many varieties are available, you can add on. At least exercise 30 minutes. I'm not saying you don't have time, you get up so early, you are making everything, ready, you're just rushing to the school because you have to be on time and all that. Then while you're going back again, you have plenty of works to do. Fine. So you're almost keeping, I'm not saying you go and hit the gym. No. Say no to all this. So early detection can save lives. You can ask questions. Come, let's fight together the cancer part. Okay. So you are almost. Welcome. So it is open for any questions. If you want to ask any questions pertaining, particularly regarding this, or you can ask me personally also. If you are hesitant in asking in the crowd, you can ask me personally and all. So that's your choice.
One question is there. If we are going to take the vaccine, that will be effective for the whole life?
Yeah, it is effective. That's why we are giving the 3 doses.
And for boys also, that's 11 to 12 years of age?
I'm saying it is 9 to 26 years. If you are not comfortable in giving it 11 to 12 years, you can, little bit delayed, but, get them vaccinated in an appropriate age. Okay. Why this WHO has given 11 to 12 years and earliest 9 years of age? Let me tell you. The body's immune response to any antigen is wonderful at earliest age. तभी तो at birth में BCG लगाते हैं, DPT लगाते हैं, इसीलिए, ठीक है? And why it is important? Because WHO, whenever they give guidelines, it is for the whole world, not just for India. We say in the Western world, sexual activity starts early. That you know it, all of you know it. We are not going into all those details, and that's not our point of discussion here. क्या इंडिया में childhood marriages नहीं होती मैडम? होती हैं? तो sexual activity होगी ना start early. I'm not just discussing here about the premarital sex and all that, but I'm just pointing out one thing. Childhood marriages, to be saying it very sophisticated terms, so they are at risk. So that is why vaccinate them before, na? Before that antigen enters, we're already creating the antibodies, and it is a wonderful immune response if you do it early. Okay.
Thank you. Ma'am, can fibroids be cancerous?
Fibroids are not cancerous, these are the benign growths. And if I do ultrasound in all of you, the females, the abdominal ultrasound, many of you will get fibroids.
Yes.
So it is just because of the estrogen content in the body. Okay, fibroids are benign. And if it is not causing any harm, don't take any medicine. Let it be. And as your age proceeds, okay, it will shrink because ovarian hormones estrogen will be stopped. So it will shrink. If it is causing any problem, only then get yourself, treated by the doctor. And again, in the young girls, PCOD is a very common problem. Okay, that is also a risk factor for infertility and all that. But it is highly treatable also. Every month there is ovulation and hormonal secretion from the ovaries. So there are 3 types of cancers if we talk about the genital tract cancer. One, most common, is the mouth of the uterus cancer, that is cervix. But whenever a married female is going to the gynae doctor for any kind of checkup, we do a per speculum examination. So earliest we can pick up. Okay, if it is in the uterus, okay, then it is not early to detect. If there is any menstrual problems, any female who is having any menstrual disturbance above 40 years of age must get DNC done, because it might be a risk factor for some undergoing cancer. And ovarian cancer usually occurs in older age group. Okay, where 70 years of age group, it is malignant, it is highly spreading. So this is why I emphasize so much about the 2 cancers and all that, because these are the 2 highly preventable cancers. That is, one is the breast cancer and another one is the cancer cervix, which is WHO and national guidelines, we can do the screening part. But cancer cervix is unique because we know the causative agent HPV, that is sexually transmitted. Number 2, vaccine is available. Number 3, screening test is easy and we can eradicate. Among 100 cancers, this is the unique cancer. And about the liver cancer, alcohol is the biggest risk factor, and smoking and tobacco, though always har ek cancer mein hai, theek hai? And all of you have already vaccinated against hepatitis B, national immunization schedule. तो इंडिया नंबर 1 किसमें है? पॉपुलेशन. कहीं तो नंबर 1 पे पहुंच ही गए हम, चाहे पॉपुलेशन में ही पहुंचे. ठीक है. सो इंडिया इतना इरेडिकेशन से दूर क्यों है? बिकॉज इतना ज्यादा पॉपुलेशन, इतना ज्यादा है. अब ऑस्ट्रेलिया जैसी कंट्रीज में एवरी ईयर 200 फीमेल डाई ऑफ कैंसर सर्विक्स. इंडिया में तो डेली है, क्योंकि कोई कंपैरिजन ही नहीं है ना. पॉपुलेशन सेम हो तो कंपैरिजन होगा ना. पॉपुलेशन इतना डिफरेंस है.
Ma'am, may be costly also.
Yes, cost of one vaccine is 3,500.
Yeah, ma'am, the poor people that they are not able.
Yes, तभी तो so much like गवर्नमेंट ने बोला तो था कि नेशनल इम्यूनाइजेशन शेड्यूल में ऐड करेंगे, बट अभी तक तो नहीं
अभी
है.
तक नहीं.
अभी तक नहीं है.
Awareness is the major thing.
Yes, awareness. That's why our hospital is towards the school health. The colleges.
I want to share with you.
Yes.
I'm aware about all these things. I went for a test. Another problem that I was facing, if I just went to a doctor, कि I just want to go for this test. आपको कोई problem है? कुछ feel कर रही हो? मैंने कहा नहीं मैम, just do one thing. This tablet, this present, come with after 15 days, and we will see. We will suggest a test or not. Because I have a lot of discussion with the other ones. Everyone avoid this is the only reason. Na? When we go to the doctor, they suggest some other things and come again, then we will suggest you the test.
See, it depends, like teachers बहुत polite भी होते हैं, थोड़े से strict भी होते हैं, तो वही difference मैं बोल सकती हूँ. ठीक है. And when मतलब depend भी करता है कहाँ पे गए.
I just named the hospital, Saroj, Max 40s, even the doctor lab and Sarah Diagnostic. I just went there.
Maybe they're just going for symptomatic patients. Maybe.
Yes, ma'am. This is the problem now, because if the where
प्रॉब्लम तो मैडम हर एक साइड से है. प्रॉब्लम तो हमारे साइड से भी है.
This is the reason doctor never be listen to that. You know, ma'am, there is no symptom. We can't.
See, when I was working in Safdarjung Hospital, we are supposed to see 50 patients effectively. We used to land up seeing 300 antenatal checkups and all that. तो जल्दी लेट हो, जल्दी एग्जामिन करो, जल्दी से बेबी का फिटलाट सुनो, चलो नेक्स्ट आओ and all that. So these are private hospitals and they don't have that much of crowd when we used to have. Okay, in the government hospitals and all, so person to person थोड़ा variation जरूर होता है. And maybe these hospitals are not properly towards prevention. Prevention वाली चीजें कुछ एक hospitals में है. वैसे तो आजकल सभी में कह रहे हैं कि it is national guidelines. ठीक है, बट वही है ना, सब गाइडलाइंस बनती हैं और हम पब्लिक भी तो नहीं फॉलो कर रहे हैं ना. ठीक है, पब्लिक में डॉक्टर भी तो पब्लिक ही है ना, नर्सेज भी पब्लिक ही है. पब्लिक का मतलब हम सारे ही हैं. पब्लिक डज नॉट मीन ओनली स्पेसिफिक प्रोफेशनल्स और नॉन प्रोफेशनल्स, इट इज ऑल ऑफ अस. सो वही है कि हम अपने आप को ही सही कर सकते हैं. यू आर ऑलमोस्ट एब्सोल्युटली राइट, बट वही मैंने सिंपल सा डिफरेंस बताया. एक बहुत ही पोलाइट टीचर, अरे बेटा बैठ जाओ, अरे बेटा कोई नहीं, और एक थोड़ा सा स्ट्रिक्ट. ऐसे ही एक डॉक्टर, अरे जल्दी दिखाओ ना, जल्दी करो, क्या कर रहे हो ये. ठीक है, इवन आई विल बी like telling a lie if I have not done that. Okay, even we have done that during our post graduation time. Okay, when it is too much crowded and all that, and even being as a part of a postgraduate doctor in the reputed hospital, 2000 bedded, we used to have lot of crowd and all that. And doing 24 hours duty and all, not very easy task. Okay, so I hope I have answered your thing. You are absolutely right. This is what is lacking, and we don't have a patience, but I'm really appreciating and good hand of applause for you guys, that every one of you are, very attentive and all that. And I hope that I end my this session, yes, you can ask, please.
Yes, ma'am. Ma'am, apart from being a good doctor as you are, I appreciate that.
Maybe I also have some of the negatives and all. I don't accept that.
Because we are in this session from very beginning, and
Yes.
you have explained all the things very wonderfully. So I appreciate that you being a good doctor as well as you have good attribute of a teacher as well. So I must appreciate that.
It deserves a round of applause.
Thank you so much. Thank you so much for your words of appreciation. But we have been visiting so many places and all that. But this is a wonderful crowd, I must say. Okay, wonderful.
I have one question, ma'am.
Yes.
So you have mentioned one of the vaccine
That's
for
me.
kids, something.
Gardasil.
Gardasil. So that is available easily in the market.
Yeah, it is available easily, and you know, like even if whenever you are planning for the vaccination part, always refer to the big hospitals, because I don't advise that you go to the small clinics and all that where the proper cold chain is not maintained. Let me tell you, we are daily vaccinating. Around 60 vaccinations are there in a month in our hospital about HPV and all that. Okay, so you know, like from the pharmacy, the person who is going to get vaccinated, they buy the vaccine, and to reach to our room, preventive oncology, it is just escalator distance, but they are giving in ice pack, like just to maintain the cold chain. And that is what I am saying. I am not saying you just come to our hospital and get it vaccinated. You can get the vaccination done, okay, but you know, like just make ensure, because all of you are educated, that proper cold chain is being maintained. That's why always refer to the big hospitals for that.
Thank
Thank
you.
you so much.
Yes. That 0 to 6.
Zero means today you get,
Right,
it is a
exactly.
zero
So
dose.
I am done with the 0 and 2 vaccine earlier.
Yes.
But my 6 months was delayed.
Yeah.
So I need to start that again 0
No,
to 6.
no. You've already got your, antibodies made in you. So you can get just boosting dose.
Okay, that's 6 months.
WHO pipeline is saying that this will be just one dose sufficient. So you've already got 2 doses. So get the 3rd dose itself. You no need to repeat. And those who have got Cervarix, and you think like Gardasil 9 has come, so let me start the schedule with Gardasil 9. No, it is not recommended. And again, one more thing. This vaccination is not for pregnant ladies and all. Just mind it.
So at the age of 18, I took that 0 and 2. I don't remember, maybe 0, 1 and 6.
Okay.
So I
But you can just get Gardasil, plain Gardasil done. That is quadrivalent, and now you can get it done.
last.
So it is just boosting up ना. वैसे तो like कोविड वैक्सीन हम सब ने कहीं ना कहीं बूस्टर अवॉइड भी किया, मैंने तो अवॉइड ही किया, ठीक है. तो आई हैव टू ट्रैवल, तो इसलिए मैंने वैक्सीनेट करा लिया. एक दिन लगाया पहला डोज तो मेरा हाथ ही नहीं उठा. सेकंड जब डोज लगाया तो मैं बिल्कुल ही लेट गई. बूस्टर हमारे हॉस्पिटल में अवेलेबल भी था. मैंने कहा यार नहीं ले सकती. देखो ना मैं कितना नेग्लिजेंट हूँ.
मैम एक्सक्यूज मी,
Yes.
छोटे बच्चों में कैसे डेवलप होता है कैंसर?
छोटे बच्चों में बहुत सारे टाइप के कैंसर्स हैं. इसमें ब्लड कैंसर काफ़ी कॉमन है. और
कैसे?
ब्लड कैंसर्स वगैरह में क्या होता है कि बहुत इजीली टायर्डनेस है, मल्टीपल ब्रूजिंग आ गया है, हर जगह से माउथ से ब्लड में मतलब यूरिन में ब्लड आ रहा है, तो कहीं ना कहीं ब्लड कैंसर का सिम्टम हो सकता है. एनोरेक्सिया है, वेट लॉस है, फेलियर टू थ्राइव है, ये सारे सिम्टम्स हैं. कहीं ना कहीं कुछ यहाँ पे गांठें हैं, जो कि सबसे पहले हम सोचेंगे कोई पायोजेनिक इन्फेक्शन है, फिर हम सोचेंगे कि उसको टीबी हो सकता है. फिर जब हिस्ट्री वगैरह लेंगे, एग्जामिनेशन करेंगे, उसकी एफएनएसी लेंगे, तो पता चलता है कि हॉजकिंस लिम्फोमा है. तो इस तरह की चीज़ें हैं, ठीक है. तो वो तो सिम्टम्स हैं कोई भी, ठीक है. बट किसी को भी सिंपल सा मैं एक एग्जांपल ले रही हूँ. इट इज़ आई एम सॉरी, मतलब यू आर द बिल्डिंग ब्लॉक्स ऑफ आवर सोसाइटी, younger generation. So just asking you, a person comes to you and he has blood in the sputum, that is hemoptysis, anorexia, weight loss, fever for 1 month. What do you suspect?
Tuberculosis?
Excellent. So you have been answering wonderfully. It's a tuberculosis. Rather than thinking, अबे यार इसको तो lung cancer हो गया. नहीं. ऐसे ही blood in the stool. What you will suspect? Hemorrhoids, piles. ना कि उसको rectal cancer है. इतना भी नहीं है यार, मर जाएंगे लोग सारे लोग. ठीक है. So handing over to the sir. And thank you very much.
Thanks a lot, doctor. I think she used absolutely simple language. Why I said she used absolutely simple language, because a person like me has also understood. So that's one reason. Second is, I think Rajesh has said something, I agree with him, that she is an excellent communicator. I think if she wishes to be a science teacher with us,
I would love to take classes. But sir, मैं यहाँ की मैडम से उतना मतलब नहीं पढ़ा पाऊंगी, क्योंकि Years ago, we have been studying.
But the only thing is, we may not be in a position to pay her that what she
So
pays.
that I can take complimentary lectures also. It's not a problem. But physics, chemistry, chala gaya.
I'll request her, when she has got, if any negative swings of mood, any time, she can come to us, have a session with us, and when you find a crowd like this, you really get up professionally that I know everything.
Wonderful. Wonderful.
God bless you all. God bless you all. And I wish that we should have healthy life, but healthy doctor friend with us.
Yes.
So that we should. Thanks to thank you. And I'll request, ma'am, if it is possible, before you leave, just give the name of that vaccination to our so that people should know it. And please clarify one more thing, that it's not awareness amongst us about the. Frankly speaking, I heard it for the first time. But say, I think you gave age group till 26. But
Before
if
marriage.
people
We can say before marriage.
if people have reached to say 30 or early 30 or late 20s, should they go for it or not? That's another thing that
Yes,
will help
I'll
them.
just answer this question because this is very, very important. Recommendation is before marriage or before the sexual activity starts, but if a female or a person is not getting married till 35, you can get yourself vaccinated. Okay? Why after marriage we are not recommending? Our hospital is not recommending because it will just give 10-20% protection. Not much. Because once you get into a relationship, okay, so HPV virus spreads unless until the couple is using barrier contraceptive. If throughout the life they are using barrier contraceptive, then the chances of getting HPV infection is 0. But that's not possible because those who are married couples, they are going to plan the family and all. So already the virus has already entered. So then doing the immunization will not help. Screening is the one which is important.
Thank you very much. And I think you should take one session with the young people about family planning also. Because the reason is that simple. The moment they start realizing about family planning, I think they have already crossed the limits. Thank you.
Thank you so much, sir.
Thank you so much, ma'am, for such an informative session where we were enlightened with symptoms and preventive measures for the most common cancers in our country. Prevention and early detection will definitely help us to avoid major consequences, and through your support and guidance, we will definitely achieve that. Thank you so much, ma'am.
Thank you.